Hello friends, now I would like to explain you or I would like to discuss you with ophthalmology. In that I would like to start with errors of refraction and accommodation chapter. Errors of refraction and accommodation is a chapter which I would like to start today. So this errors of refraction and accommodation. In this we would be dealing with different diseases, basically which we see lots of people in our life. Even we, all of us or most of us are suffering with these diseases, and these are day-to-day life activities. So coming to errors of refraction, we should know some terms. So let us start a discussion with two terms, and in this chapter we would deal with hypermetropia, right? So first, what is emmetropia, right? You should know what is emmetropia. Emmetropia is normal eye. It basically refers to normal eye. So this emmetropia here, if you see the focusing of eyes on the retina, just a minute, I'll just give you. So seeing these both are the emmetropic eyes. So here in these it's normal eye, that is the parallel rays are focused onto the retina from infinity. So these are the parallel rays from infinity. These parallel rays from infinity are focused on retina, right? So this is about emmetropia. Now coming to the second term, which I would like to make you understand, is ametropia. This is ametropia. So what does ametropia mean? So here ametropia is a refractive error. Emmetropia is normal eye. Eye with refractive error is ametropia. Eye with some refractive error is ametropia. So this ametropia eye, here the rays, parallel rays, don't focus on retina. So they are of many types, right? So first type is myopia, next hypermetropia, and then astigmatism. All these are the three different types of ametropic eyes, right? Ametropia, these are basically three types, as you have seen. One is myopia, and the other is hypermetropia, and the other is astigmatism, right? So now let us deal with each of them in our everyday class. So first, in today's class, let us basically deal with hypermetropia, right? So first, in our today's class or now, we would generally deal with hypermetropia. So what is hypermetropia? Hypermetropia is also called as long sightedness. Here the people can see the long vision, that is the far objects can be seen well, right? So this is long. Here the objects are from long distance. For example, let's see the diagram. So here in this diagram, if you see here in hypermetropia, basically the focus or the parallel rays which are present, they are focused behind the retina, right? So here parallel rays are focused behind the retina. That is point 1 and most important one, right? So what are the etiological factors of hypermetropia? So coming to hypermetropia, etiologically it is divided into 5 types. One is axial hypermetropia. So as the name says, here there is axis, right? Axial. Axial is the axis. This is the axis, right? So there is difference in the axis. So here there is, in axial hypermetropia, there is shortening of this is the anterior posterior, this is anterior, this is posterior. So this is anterior posterior. So shortening of anterior posterior diameter. So this becomes something like this. So this is AP diameter, which is shortened. That is in axial hypermetropia, there is shortening of AP. What is AP? Anterior-posterior diameter is shortened. So this is axial hypermetropia. The second etiological factor is curvational. Curvational hypermetropia. So what happens in curvational hypermetropia? See, as the name says, curvational. So here you can see the cornea has some curvature. Even the lens has some curvature. These both becomes flatter than normal. Right? These are like this. So here they become flatter. So here there is, I'm sorry, just a minute. I'm really sorry for the inconvenience. So here basically the curvature of this lens and cornea becomes flatter. So flattening of curvature of lens and cornea occurs. What does this happen if there is flattening? This leads to decreased refractive power, right? This leads to decreased refractive power, leading to hypermetropia. So here 1 mm increase in radius leads to 6 diopters of hypermetropia, right? Similarly here in axial hypermetropia, 1 mm of shortening leads to 3 diopters hypermetropia, right? These are the two types of hypermetropia, axial and curvaceous. Now the third type includes index hypermetropia. What does this include? In index hypermetropia, there is basically index. So what is index? Here in eye refers to refractive index, right? So here there is decrease in refractive index of lens basically. So this index hypermetropia, it generally occurs in old age, that too due to cortical sclerosis. Cortical sclerosis in old age leads to decreased refractive index of lens, right? So this is index hypermetropia. This can also occur in diabetics. Even in diabetics, there may be decrease in refractive index of lens leading to hypermetropia or farsightedness. Then the fourth type of etiological factor is positional hypermetropia. Positional hypermetropia. Here, as the name suggests, here there is a change in position of lens. Right? What happens? Here the crystalline lens which is present in our eye, this crystalline lens, it is placed posteriorly. The crystalline lens which is present in our eyes is placed posteriorly in positional hypermetropia. The final one is absence of crystalline lens. Right? This absence of crystalline lens may be due to congenital or acquired, right? So this absence of crystalline lens also leads to hypermetropia, right? All these are the etiological factors leading to hypermetropia. One is axial hypermetropia, that is shortening of anteroposterior diameter, and the other is curvaceous hypermetropia, where there is flattening of curvature of lens of cornea and curvature of lens and cornea. Index hypermetropia, where there is decrease in refractive index of lens. Positional hypermetropia, where the crystalline lens are placed posteriorly, and absence of crystalline lens, which leads to congenital and acquired, which may be due to congenital or acquired. This basically leads to a condition which is called as aphakia, which we will be discussing in our next few classes, right? Okay, so now let us see the clinical types of hypermetropia, right? What are the clinical types of hypermetropia? So let me take a new color here, that's probably blue, right? Clinical types of hypermetropia, right? What are the clinical types of hypermetropia? The clinical types of hypermetropia, these basically include, first one, Okay, basically there are two types. Okay, first, second. Simple hypermetropia or developmental hypermetropia or physiological hypermetropia. Right, all these are the different types of hypermetropia, or it may be non-physiological hypermetropia. Okay, in simple or developmental or physiological hypermetropia, it is the common form, that is the one thing you should keep in mind, and this basically results from biological variations. Right, so these are of basically two types. One is, as we have already said, it may be axial or it may be curvational. Right, it is of two types. One is axial, that is developmental axial hypermetropia. The other is developmental curvational hypermetropia. Next, non-physiological hypermetropia. It is due to the conditions which are outside the normal biological variation, right? It is physiological, so these are biological variations. Non-physiological or non-biological variations, right? That's what it means. So non-physiological is of two types again. It may be congenital, that is occurring from birth, or it may be acquired, that is after birth. If something occurs after birth, then it is acquired. If congenital, if it occurs before birth or with the birth. Right, so first, congenital. In congenital there are many types, like microphthalmos, that is small eyes, nanophthalmos, very small eyes, microcornea, which is small cornea, aphakia, absence of lens, or posterior subluxation of lens. Posterior subluxation of lens. Right, all these are the different congenital conditions of non-physiological hypermetropia. Next, the two congenital. Now coming to acquired causes of non-physiological hypermetropia, there are different types. Right, it may be index hypermetropia. Okay, let me write it down. Right, it's really many, so I'll write it somewhere here. I'll end today's class with this. One is index hypermetropia. Right, it may be due to index hypermetropia, that is decrease in refractive index, or curvational, that is change in or flattening of curvature of lens and iris, or it may be positional hypermetropia, and then it may be aphakia, which is absence of lens, axial hypermetropia, which is acquired conjunctival hypermetropia, or pseudophakic hypermetropia. Pseudophakic hypermetropia. All these are the different causes of acquired non-physiological hypermetropia. Right, so this index and curvational hypermetropia, these are grouped under senile hypermetropia, which occurs in old age. So all these are the different types of hypermetropia which you will see. In our next class, we would deal with components of hypermetropia and their clinical features and treatment. Okay then, bye.